Hello, everyone. I think we'll get started. Thank you, everyone, for joining us today. My name is Gwen Schufro. I work at the Tamer Center for Social Enterprise at Columbia Business School. This webinar is one in a series of webinars on social impact that we plan to host at least weekly during this crisis. The topic of today's event is a very pressing issue, food insecurity in New York City. I'm delighted to be joined by Greg Silverman, Executive Director at Westside Campaign Against Hunger, Katherine Miller, Vice President of Impact at James Beard Foundation, and Emma Hulse, Manager at New-York-Presbyterian Hospital. Just before I turn it over to Greg, I just wanted to go over a few housekeeping items. The first is that this event will be recorded and we'll send it out to all participants post-webinar. Second, if you have a question for the panelists, please submit your question in the Q&A feature at the bottom of the webinar. Thank you very much. And now let's begin with Greg, who will describe his organization and the current issues he's facing.
Hi, everyone. Thanks for taking time out on a Friday afternoon, whether you're busy taking care of your kids at home or busy studying from home or busy working from home. I appreciate you taking the time. So my name is Greg Silverman. I'm the Executive Director of the Westside Campaign Against Hunger, an organization that for 40 years, its mission has been to alleviate hunger by ensuring all New Yorkers have access with dignity to a choice of healthy food and supportive services. As everyone on this webinar can attest, the recent pandemic is affecting all of us. Everyone is stressed due to it. Everyone is having struggles procuring what they need in their lives. And the community I serve, the 20,000 customers who come to us for healthy food and supportive services, have even further struggles than they normally do in their day-to-day lives. So I hope I can give a little bit of a taste of what we're seeing on the ground. Out here in New York, we're based at 86th Street, right off Broadway. I was out there today. I still have on my trusty mask and hat because we're out there feeding people on the streets. For those of you who want to know, look on their own, obviously you can look on the website and see wisca.org, www.wscah.org, to read more about us, to learn about us, to contribute to our efforts that you'll learn about. I'd also say you're going to hear from some good friends of mine, and firstly in Katherine Miller today from James Beard Foundation, an organization I'm a proud member of and deeply engaged with. And I think they've had a huge effort to help food and beverage professionals across the country. And I'm sure everyone on this webinar has been to a restaurant that has been affected by this. So this is the time not only to tip better than you've ever tipped before when you get takeout, but to contribute to our restaurant industry, because we need them back, because they're such a deep part of the culture and fabric of America. So you can check out for the Food and Beverage Relief Fund at James Beard as well. I also flag the things that we don't think about, like food is the tip of the spear right now, and we are in dire need, but the arts and sports, nonprofits, these are a lot of nonprofits are going to go under right now and not be able to make it back. And again, part of the culture of America is the arts and sports and music. And so if there's a favorite charity out there for you, I would find a way to contribute to them as well. Someone asked me once, what's the need right now? And I said, I don't even know what the need is right now. We have unemployment skyrocketing. We have families separation issues from a virus and self-isolation, but we still have continued issues of immigrant families having issues with immigration status and that kind of separation. We have health issues skyrocketing. It's not just the virus, but we have long-standing health issues that continue to plague the communities we serve. WSCA, our shortened name for Westside Campaign Against Hunger, is one of over 700 pantries and soup kitchens that operate in New York City to feed food insecure New Yorkers and making sure people don't miss meals and get healthy food. And the truth of the matter, in the last 4 weeks, 30% of that network of 700 pantries and soup kitchens no longer exists. They've gone out of business. They've had to close up for a variety of reasons. And that is traumatic for not just hundreds and thousands of families, but millions of people in need and a growing need. So I'll speak a bit about what we do and how we've had to transform our efforts, right? We serve 20,000 people every year, about 11,000 families, through firstly a pantry, right? We're what's known as a pantry. We hate that word. We're a grocery store. We, for 25 years, have been a free grocery store for folks in need across the city. We serve about 50% fresh fruits and vegetables. We have fresh and frozen chicken and pork and fish and fresh milk and alternative dairy. We have a limited selection, but we have an amazing selection of the healthiest foods out there. People shop with us in person. They push their cart through the grocery store. They do online reservations so that they can be quickly in and out of our grocery store. And it takes about 1,700 volunteers on top of our 24 paid staff to make this effort happen. Volunteers such as actually Katherine's husband, who's on the line right now, to make sure that we can pack up food and have it sorted through, that the 500,000 pounds of food we get from City Harvest alone can be sorted through that we can get it to our customers. We realize over time that bringing people to food on the Upper West Side is nice to a grocery store, but more important is to bring food to people. So we have a mobile market where we partner with different agencies and organizations such as Emma and NewYork-Presbyterian to bring food to community members in need, directly where they live, learn, and play. That's turning off a phone, sorry. We do this work in a mobile fashion as well, because we know not everyone has the ability to get to us, right? Seniors have a tough time coming. Folks related to immigration status don't want to leave their neighborhoods. And it's just more convenient because everyone has a right. Everyone should have that same dignity of getting the food the way they need it and want it in their lives. We normally train about 50 people a year in a 12-week intensive free culinary training program, giving people jobs in the food service industry. And of course, we have social services. And my background's as a chef and restaurant owner. So when I think of our efforts, I think of our food pantry somewhat as an amuse-bouche of a high-end restaurant. And our social services, where we get people access to SNAP food stamps, for health insurance, to immigration supports, to rent abatement, that is the main course. We need to give people deep support so that they can actually be lifted out of food insecurity and eventually out of poverty. So, of course, at this point, I always, in any talking points I have to thank my team right now, because my team of frontline service workers for years have known they're important. They've never been told that they're essential personnel in a pandemic. They've never been told that no matter what's happening, they can travel through the city, and that we're going to ask them to be on the front lines of serving the community in a situation where I have one staff member who is coming through. They've been isolated for 13 days and they've come through having COVID, but our staff are putting, in some sense, they could be potentially putting their lives in jeopardy in order to feed hungry New Yorkers. On a Friday, I normally send out a note to my board and my staff and volunteers with some ideal levity and positivity. I've been saying a lot these days, I can't say when this is going to be over, but I can say that we're seeing powerful change and that we're doing amazing things on the ground in ways we couldn't before. Today, we sent over 9 pallets of food to Bellevue Hospital, so that every single patient who leaves that hospital after COVID was discharged leaves with food, right? This is somewhat unheard of. We've all been talking for years about food as medicine, but this is proof in the pudding, saying, here's your prescription. When you go home, we want to make sure your fridge is full with great food. But I spoke to you a bit about what we've been doing for years, but from March 13th, Friday the 13th is what sort of our big day, everything changed, right? Our 86th Street Pantry, in operation for over 25 years, closed down, and we moved every bit of that operation to be on the street. So every day we build and take down our market for our customers. Our social service office, where customers would come in and meet directly with our staff and find out about benefits, has now transformed to be completely virtual. We were going to have a spring lunch to raise $100,000 for our efforts. We can't bring 200 people together and have them eat food cooked by our Culinary Pathways program in today's day and age. Our 1,700 volunteers, we canceled that entire program for the last 3 weeks. And to tell our customer volunteers, some of them who volunteer 40 hours a week for the last 10, 15 years, and we couldn't have them volunteer, probably the toughest message I had to send, because it's for their own safety. We didn't want, Zoila, who's 77 years old, coming in to volunteer with us. We wanted her to stay home and at home and be safe. But we continue to find new ways to reach the need. We've upped our communication with our community, setting volunteer calls to our customers. We've raised obviously hundreds of thousands of dollars because we're the tip of the spear, like getting food to people. We've spent an extra over $10,000 every week on food that we normally wouldn't need to purchase. We've built new partnerships. We're just starting a partnership where we will be, through United Way, having delivery drivers will be taking food that we pack up to customers, to our seniors in their homes. So in the last month, we would have had in February, we had 1,300 seniors come get food from us. In March, we had 700 get food from us. So almost half the number of seniors have come to our pantry. So we're going to go after that segment of 600 people, and we're going to reach out to each and every one through our text messaging service and say, do you want your food delivered? And we're going to be able to do that through a partnership with United Way and DoorDash and others. So where will this end? When will we get past it? I'm not sure, but WISCA that's the question we've been asking for 40 years. When are we going to get past food insecurity in New York City? When are we going to get past a situation where poverty exists, where people have living wages and have health insurance and have affordable housing? I mean, these are the big questions. And how we can work on that is in partnership. And it's in partnership with folks like Emma, who's going to speak next, because I'm happy to have her here today, because their team has been incredible at transforming how WISCA thinks about its entire operations, partnering not just with another group, but to say with a hospital network who said, we're looking at social determinants of health and we want to track moms of kids 0 to 5 and get them food, and can you help us? And was like, this is actual perfection. So I won't speak too much more about it. I want to pass it over to Emma to talk about all the great work they're doing and maybe on the front lines of what's happening in the hospitals and how hopefully WISCA has been helpful as well.
Yeah, thank you so much for having me. Thanks, Greg, for that introduction. I'm really excited to talk a little bit about the work that we're doing in partnership with WISCA, but before I do that, I just kind of want to give a little bit of a background. My name's Emma Hulse, and I oversee several community-based programs through NewYork-Presbyterian Hospital. And one of them is Choosing Healthy and Active Lifestyles for Kids, which is an obesity prevention program. It's been around and fully supported by the hospital for over 10 years, which is really amazing. Historically, CHALK, the acronym, has worked with elementary schools in Northern Manhattan. We help assess wellness at an organizational level and really work with key stakeholders to co-design a program that will be sustainable for the school. We have really expanded our work, and we now work with everything from faith-based organizations to community-based organizations, early childhood centers, high schools, parks department, WISCA, you name it. Whoever will work with us, we will work with them to promote wellness in our community. And I think our entree into the food insecurity work really started with our faith-based organizational partners. A lot of these partners, their missions were to help feed the people, and they wanted support in doing that. So our first faith-based partner, La Porta Estrecha, is a small church up in Inwood. They wanted to open a food pantry, as a lot of churches want to do, but they were able to, with our support, help receive funding for $35,000 to start a food pantry. And they serve, or were serving, they no longer are operating right now during COVID, which we'll talk about in a minute, about 300 families a week. So Northern Manhattan has lacks a lot of resources around emergency food. So we saw that we can partner with these faith-based organizations to start pantries. We can help provide them with organizational support and infrastructure and connect them to the appropriate resources. So our first connection with WSCA and their mobile market was through another faith-based partner who wanted to have a food pantry, not necessarily on site. And so we started working with them, and it was a really great partnership, and we served about 100 families or 100 individuals a month. It was going really well. And I kept saying to my leadership, like, we need to have the mobile market outside of our outpatient practices. We need to have a food pharmacy connected for our patients. And I said it a lot, and I think people started to hear me, which is great. Another really big catalyst for doing our food insecurity work is that we started screening for social determinants of health at our outpatient practices. So we have about 5 outpatient practices throughout Northern Manhattan, and they serve over 20,000 patients and their families. So they started screening for social determinants of health, such as food insecurity, transportation, and housing. And they started to see that about 30% of their patients were screening positive for food insecurity. So obviously you can't screen and then just say, good luck. That's nice. That's nice that that happened. I think it's about connecting to resources after that screening happens. And as I said, there were really not a lot of resources available in our community. So bringing a partnership with WSCA and the mobile market to one of our outpatient practices was just kind of the next logical step. So we started about a year ago, last May, I think. We started, and we serve families 0 to 5 or patients 0 to 5 and their families. And we have twice a month distribution. The distribution is based on family size, which is really exciting. And we, in addition to providing them with food, we connect them to other resources. So WIC and SNAP enrollment, having an on-site SNAP enroller is really important part, because we don't want to just give them food forever and ever. We want to make sure that they're tapping into other resources that are available to them. And I think I just want to note that in our community, it's a primarily immigrant community. With the current administration, we've had a lot of struggles about connecting them to the resources, even if they are eligible, just because of the fear of public charge, of the fear of being deported is real, and people are very afraid in accessing these services. So I think, you know, it changes the conversation if your pediatrician is saying to you, hey, we have this on-site program where you can get food, and then the people that are part of this program are saying, we'll connect you to SNAP, you're eligible, like this won't interfere with your immigration status, this won't impact you negatively, like you can access these resources. It's a very powerful statement, and it's very powerful for a healthcare system to have this conversation. And it really means a lot to the community, and it means a lot to our patients. So I kind of want to talk a little bit about what our work has looked like in COVID. So all of our other community-based programming has completely stopped. Most of my team has been pivoted to do clinical work, to support the clinical work, in that they're helping to support the telemedicine efforts so that people are not coming on site, but they're still getting the care that they need. However, we've also ramped up a lot of our focus into food insecurity. So we went from doing 2 monthly distributions with mobile markets. Now we have, sorry, I have it written down, we have 12 monthly distributions with mobile markets, and 2 additional distributions with Corbin Hill, which is a farm share program. So we're aiming to serve over 500 families just in this month alone, and distribute, you know, a ton of food to people, and be very creative in how we get that food out to people. I think people are afraid to leave their homes, as, you know, we're being told to stay home. So now we're having these conversations with WSCA and other organizations of how can we do a home delivery system and delivery service. So we're getting very creative. I think NYP is uniquely positioned to be able to do this type of work. So Greg said that 30% of these food pantries have shut down for temporarily. And our food pantry that with the church has closed because they just don't have the capacity or the resources to be able to run a food pantry right now. You know, we are part of a healthcare system, so we have access to masks, to face shields, to all the resources and tools and that we need. No one's getting furloughed, so we have the staffing there. We are connected with Columbia, so we have volunteers. I think it's really like a unique and interesting time. And we're not planning just for COVID, we're planning post-COVID now already. So I think we really need to start thinking about what is it gonna look like in 3 months, because the cracks of inequality and lack of resources that our families had before are just so much bigger, and the barriers are just so much bigger. So thank you. Yeah, that's, I think I'll end there. I could go on more, but I'll end there for now.
I'll just say, before turning it over to Katherine, I'll say, like, right when I was asked to be on this panel, right, my background, as I said, like I had 3 restaurants that I sold in 2008 and around the time of the financial crisis. So I have a little in of what it would feel like when a huge change happens to the restaurant industry, what could happen. But I can't actually imagine what's going through right now. And so I firstly thought like Katherine needed to be on this panel to give another side to this work. So I hope Katherine can help us all understand what's going on at a different level of this as well across the nation and in New York, in our food system, and our, right, maybe it's just as a chef, but our dearly beloved, not just our food system, but our foodie system so take it away.
Yeah, no, thank you for having me. And you know, it's interesting to be in the context of this conversation around feeding New Yorkers and feeding New York, because the restaurant scene in New York City and across all the 5 boroughs is incredibly dynamic and amazing, in part because of the restaurant workers who are in it every day, from the front of the house and the back of the house. In New York City alone, that's 250,000 people who are employed in restaurants. And by the initial estimates, 189,000 of them applied for unemployment benefits in this first month. So it just, like, when I let that sink in, about how many people are new to the system of government benefits, whether that be unemployment insurance or the need to have suddenly found themselves among the community of New Yorkers who might be food insecure. You know, it's sort of devastating to think about, right? And then you extrapolate that across the country where, you know, there are 11 million people who are directly employed by small and independent restaurants, which is really the heart of the New York restaurant scene, but really the heart of communities around this country. And as every couple of weeks, we get the new unemployment figures, the new benefit figures, that just ticks up. And that doesn't even include all the farmers and fishermen, and even doesn't include the undocumented among us who work in restaurants, who haven't yet accessed those systems or won't have access to those systems, right? In any meaningful way. And so, you know, those numbers just shake me to my core, right? That the overwhelming majority of restaurant workers in New York City at this time find themselves applying for the first time, many of them probably for the first time, for unemployment benefits, and then finding themselves among the millions of already food insecure in this city. The thing that kind of gives me hope amongst all of that is the way that the restaurant owners and the organizations that support restaurants and these small businesses have probably I hope it's the word I can ban from my vocabulary post-COVID, but have pivoted, right? To figure out how to best make sure that we can feed those who might not be able to feed themselves, or might have limited access, or might be in this really traumatic space of transition too. And we can't also underestimate that piece, right? We just recently did a webinar around the mental health and what resources and things can people access, whether it be AA meetings or Narcotics Anonymous meetings, to free mental health benefits and platforms, because this is also a period of trauma, right? People are scared they might get sick. People are sick. People who know people are sick. People know people who have died. So, those are some of the things that we're looking at. I mean, but the restaurant owners, especially the small business community here in New York, have really responded in a way that it just gives me a lot of hope and presents a lot of opportunities for folks. There are restaurants that have turned themselves into grocery stores, so that communities can have access to healthy food, or even just access to food outside of sort of the big box, or in places where they haven't been able to do that in the past. So that's amazing. There are examples of restaurants who have turned into the feeding and catering for our frontline workers, right? Who are providing meals to hospitals. I think of the Queensboro in Jackson Heights, Queens, and Elmhurst Hospital, is 15 minutes away. And they're providing meals to the folks that are working in those, or, folks in Brooklyn where you could still order takeout as a New Yorker if you're, right, who then also have an add-on where they'll donate soups or prepared meals for, again, those frontline workers. And then there's places that you wouldn't have expected that are actually turning into feeding centers themselves, or places at least where people can come from the restaurant community to access food. So 11 Madison Park, the most expensive restaurant in all of New York City right now, in partnership with Rethink, turned itself into a place where people can access food, meals, and groceries if they need it. So like those types of things really give me great hope at this time, and show both the resiliency and creativity of the restaurant community, but also in taking care of its own. And so we've been across the country also just amazed at what has been happening. There's the big names, like obviously like Jose Andres and World Central Kitchen, who are famously turning stadiums into emergency feeding centers, right? For restaurant workers and others. I mean, I'm originally lived in Washington, D.C. for 20 years, and Nationals Park, hallowed ground for me as a Nationals baseball fan, is now a place where restaurant workers and community workers from around the city can go and access food, right? And preparing meals. There's also folks like the Lee Initiative, a chef-driven organization out of Kentucky, which helps restaurants access money, grant money, to allow them to provide twice-a-day meals at minimum for their restaurant workers. There are many restaurant workers, in particularly undocumented or back-of-the-house workers, who one of the most nutritious meals they might get during the day is what we call family meal. And when the restaurants closed, their family meals went away. In the same way that when schools closed, school insecure children, their meals went away. And to have the opportunity for restaurants to be able to deliver that sustenance and community to their workers at this time, and also provide them with sundry items and everything from diapers to baby formula to groceries, is really powerful. And then, we've seen things like Off Their Plate in Boston, or Family Meal, as it's called in California, where they've again been providing support and meals for the hospital workers, and also working with Share Our Strength and Feeding America to provide additional resources and additional pickup points for kids at need. All these kids who are out of school until, in many cases here in New York, through all the way through May, probably longer in California till June, and Virginia until June. All of those places, all those kids who didn't have depended on school breakfast, school meals for feeding, No Kid Hungry, Share Our Strength, and a number of other organizations have really stepped up to use restaurants as another delivery platform for that at this time. So, I can't underscore the need for even restaurant workers themselves, with again that nearly 200,000 of the 250,000 already having applied for unemployment benefits. The missing folks that we're not seeing or directly counting in the undocumented workers and our farm work, and then the folks that we're not even looking at, the folks that depend on restaurants for their own livelihood, like farmers and fishermen. But I've also been they give me hope too, new community. But if you want to, there are farms now that only sell exclusively to restaurants who are now doing CSAs and community supported agriculture boxes across the city. So there's a lot of hope here, but been really struck by the need and struck by the true response of this community to sort of pivot and provide things for people at this time. So it's been hard, but exciting. So, but I'm looking forward to some continued conversation here.
Just going through some of the questions. I'm still muted. Going through some of the questions. One, actually, maybe Emma, can I shoot to you a question? Just sort of how you're seeing the need changing through NYP and related to food insecurity, and how maybe you're all thinking about it in the sort of longer term beyond the immediate.
Yeah, I mean, I think that, as I said earlier, the rates of our food insecurity amongst our patient was 30%. I would take a stab that it's increased significantly, and that, you know, a lot of the resources that are available to other Americans are not necessarily available to the population that we work with, and that now the fear is twofold, right? Like, it's the fear of ICE and now the fear of COVID is significant. So I think, you know, as an organization, we're really thinking like long term of how can we continue to maintain these resources when things go back to normal, whenever, you know, that is. I don't think that people, you know, COVID's over and then everyone's going to go back to getting their jobs. Like, I think, you know, like what Katherine was talking about, like these businesses are going to be significantly impacted, or what you're talking about, like organizations are significantly impacted, nonprofits are significantly impacted, and that really impacts the population that we work with. So how can we support them beyond COVID for as long as we can? And I think we are, as I said, uniquely positioned to be able to do that with the resources that we have.
Great. It's exciting as Emma, that we are, you know, we've been in talks since we started working about how we expand our work and get access to more people across all different areas of the NYP network. And so we'll come out of this and we'll keep driving forward. I'm going to shift totally different gears back to Katherine and the sort of question related to 11 Madison Park as an example. You know, obviously they're serving frontline workers. I guess the question's more about who's behind some of these. I know that Amex, I think, is a partner, and how are other companies responding, and how do we push more companies to do these kind of things?
Yeah, I mean, I've been really, I've actually been pretty pleased as a nonprofit organization, the James Beard Foundation. We're unique, and we're not unique, but we've always largely worked with corporations. We haven't had a big small donor program or taken a lot of money from philanthropy. We've about 75% of our revenue actually comes from corporations. So most of the conversations that we have had over the last 4 weeks have been exclusively with an increasingly generous corporate community. You know, our own Restaurant Relief Workers Fund that got $1 million from San Pellegrino and Nestle, $400,000 from Patron. Because there are some businesses currently up and operating right now that are making money, water and liquor, right? And a lot of food companies, a lot of comfort food companies. And so American Express and the platform Resi, which is a reservations platform, are supporting the efforts of 11 Madison Park, and more broadly, the nonprofit organization Rethink, which is an organization that largely focuses on the repurposing of food to eliminate food waste and works with folks. They're also partnering with City Meals. That's one of the organizations that they're working with to deliver meals that on average are costing $5 to $6, I think it is, and then delivering those meals through the City Meals program, but, you know, with the generous support of corporations like Amex and Resi. So we've actually been really excited. If you look at something like the National Restaurant Association, their employee fund, which is giving $500 individual grants to restaurant workers, that has, you know, probably some of the biggest food brands behind it and lots of money coming in there. We're excited to see huge donations going to organizations like Feeding America and Share Our Strength and No Kid Hungry and World Central Kitchen. A lot of donations by food companies, US Foods, Baldor, other folks who have, you know, have traditionally been part of our food restaurant food community, but don't have restaurants to sell to now right now. So offering significantly discounted food product and making donations in many cases, but at the very bare minimum, making significantly food available at significant discount to a lot of these nonprofits in different cities around the country. So, but I think what we can do as consumers is if you've got an Amex card or you've got a Chase card, if you have a credit card or work with a bank, like get on the phone, email them, tweet at them, post them on Instagram, tell them thank you for their support, but then they need to pony up and do more. Because this is not a time, as Emma was saying, we're not going back to normal anytime soon. And, we're sort of looking, we're going to need to feed the food insecure for a lot longer. We're going to need to figure out ways to prop up businesses so people have jobs to go back to, so that we're not looking at chronic unemployment. We're looking at a spike, right? Or let's call it seasonal unemployment and not permanent unemployment. So there's a lot more work to do. So if you're a consumer and you have access to any of those folks, I would thank them for what they've already done because they've been incredibly generous, but then I would tell them that they got to pony up more.
I'll give another food service example. It sort of crosses these things of great performance is catering, which caters, Liz Newmark owns and created it, and she's on my advisory board, right? Some of the best museums and cultural institutions in New York City, they run the catering, right? They have, I think, 500 staff and can produce up to 25,000 meals in a day. And that business is, in some sense, had to be gone. And what did she do? She's producing 25,000 meals a day for home delivered meals. Like, she has shifted to be able to shifted her business model to be able to keep her entire, and I don't know if it's entire, but to keep many people employed and to be able to serve food in a new way. And we've been emailing because the other side of this is from someone who's worked on feeding the last decade in institutional settings. I think will have some learnings and some expertise that maybe our folks at Meals on Wheels can learn from going forward. But we have to think about the donations, 100% pushing corporate groups, but also how are we supporting these companies that are making these huge pivots in a matter of weeks, right? In 2 weeks, her business went down and she's up and running for the community. So I think there are positive stories out there.
Yeah, I mean, just to double back on that, the restaurant community has always been incredibly generous to their individual communities and their folks. I mean, the average restaurant typically would have been an average year donated $50,000 directly in staff hours, meal hours, or donations to community-based organizations over the course of a year, right? And so what I find amazing is not necessarily that they've stepped up, but to the volume that they've stepped up and to the creativity to respond to the need has just been remarkable. That they are doing that and able to turn all that human power and all those resources into feeding directly those people who need it in a way that somebody asked me today. They're like, what about a risk assessment and a needs assessment? And I was like, we don't have time for risk assessments and needs assessments. We have time for doing.
Like, this is, this might sound crass, but we're always asked to do strategic planning and do all these kind of 5-year plans and, sort of business modeling. And I'm happy to say that our 5-year plan, we're in year 1 and now we're actually fast forward into year 4 because we're hitting on everything on innovation we wanted. So taking those plans out the window and saying we just got to move forward fast, and we're not going to take all the time necessary that we'd love to take to test things out. But this is from a restaurant standpoint, you make a special that someone likes, and then you actually just put it on the menu right away.
Yeah.
I want to shift gears and talk a little bit about a bunch of questions where I actually can bucket and see that are about the supply chain. And so there's questions like, what's the gaps in the supply chain? Somewhat on one level, from the farm level, and I'm going to speak from a pantry side from my work, but we're very worried about the role of farmers because, farms support restaurants, they support hotels, they support grocers, farmers markets, and they're scared about how much are they going to be able to produce and sell in the coming year. We're in planting season in much of the United States right now, and there's going to be questions of how much should I actually produce this year? How much labor do I want to bring in? Like, these are all scary pieces. And when you sort of shed that down to us, you know, in last mile delivery, still maintain is the biggest issue I would maintain, right? We can get right now, if I want to go to Hunts Point Market and pick up 20,000 pounds of fresh produce for free, I can do that. I can do that any day of the week. The food still exists. How do we get it to people in need is the problem. The last mile delivery, we're showing, the cracks are being shown right now during COVID, and that we're having a tough time getting food to people. Well, that's always been the issue, and the problem is, right, our big players like the Food Feeding America network can distribute truckloads of food. No one wants to drop off 500 pounds of food to the small pantry, right? So they end up going and buying it, and this is a problem. Like, we have to think smarter. How do we use our fleet of delivery vehicles? How do we get food delivered to people in need instead of making people come? Most people on this call probably get food delivered. Why are we asking everyone else to just go to the grocery store or a pantry? That's ludicrous. I mean, the pantry model is not a good model. And I run one of the largest best practice pantries on this planet, I promise you. But the idea that we're not just giving people like more SNAP benefits and saying, use those dollars the way you want in a grocery store, that actually is efficient. Opening up more pantries is never efficient. Like, if someone has a pantry, and I know Columbia has opened up a series of pantries on campus, like, I am happy to sort of think with them how we can support their efforts. Or as we've talked with Emma and their team, we're gonna probably hopefully be helping run a pantry using our expertise and our supply chain. Because this is not, we can't feed a city via volunteers, right? That's why 30% of pantries have already closed in New York City. It's why we have more food insecurity. WISCA is here on the Upper West Side for anyone in the community to come get food. Every student at Columbia who needs food, we would love to have them come down to 86th Street. We're happy to think through a drop-off with our mobile trucks as well. We can do these in many ways. Other resources out there, people, you know, Plentiful is an amazing resource. It's an app that anyone in New York City can use to find their closest pantry, their closest soup kitchen, and make a reservation so they don't actually have to wait. Hunger Free America is another organization, Joel Berg runs it, that has a clearinghouse of every resource that's out there. So there's a lot of resources out there, and there's not a problem with, I would say, with food. When I hear about small pantries not having food, they don't have the right food, right? The system is happy to give us all the ultra processed product snack foods we want. If I want a truckload of soda, it will be here any day. It's when I refuse that truckload and send it back is a problem, right? Getting vegetables is a problem, right? We can find, and fruits in the quantities people need when they need it in real-time delivery. Like, this is what our system has created, an amazing system to get food in real time or in products to customers in their homes. But how do we do that for food insecure New Yorkers? That's the issue right now.
I wanted to just touch on something that you talked about, or expand about the whole, like, getting that the last mile is such a like big barrier to get food to food insecure patients. And I think that the mobile market is such a great innovative approach to getting it maybe half a mile closer. But COVID has really forced us to examine how we can do the additional half a mile. So we have been working with like a local cab company to do drop-off deliveries. We have another nonprofit that is exploring an app where you can order on the app and get, like, through Instacart or through Amazon or whatever, get food delivered to your apartment. By the way, we talked about this, like, introduced this app about a year ago, and we're like, our patients will never want food delivered to their apartment. They're afraid of like giving out their address. But now with COVID, everyone's like, please, can you just deliver straight to our door? And it's really changed that conversation. So I think that's, you know, like a silver lining that's come out of that we are being very strategic and quick on our feet to think about how to close the gap in that last mile and getting food to food insecure patients.
Totally. question for everyone I'm just going to put out there. There's a, and I'll answer first and other people. Someone had a question. With 3 weeks into this new reality, what tools do you wish you had then and now so other cities can sort of learn from what WISCA and others are dealing with and New York City is dealing with? I mean, I personally, you've already heard us talking about delivery and last mile. I think getting ahead of that in other cities across America to be like, figure out how to get those, for like New York City, 90% of yellow cabs are out of business right now. How do we keep that economy rolling for all those people? How do we fill up those empty trunks of vehicles and get them places? Right? Walmart knows they would never want an 18-wheeler of food to go in any direction empty. But we let taxis and delivery people have empty vehicles. So my point would be on delivery. So I'll turn it over to Katherine and Emma.
Yeah, this is Katherine. I mean, my big one that I wish that was more prevalent is that we are a country that is really focused on individual philanthropy and individual relief, right? So rightly so want to provide benefits and grants to individuals to help them pay rent and do those things. And there is actually not a strong network of how we actually prop up those businesses in any way, shape, or form. There's a real sort of free market capitalist, like, oh, the strong will survive, or you'll pivot, or you'll figure out how to operate. We had to literally create a brand new vehicle of philanthropy to provide grants directly to businesses, right? In 4 weeks. Like we had to build it from the ground up because it didn't exist except for FEMA or emergencies that were around the physical destruction of businesses, not the shutdown of businesses. So I would love to have yellow cabs on the road, you know, blah, 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 but there's no mechanism by which to pay them from a philanthropic standpoint, right? There's no, and so, you know, it's a frustrating piece for me that, you know, in part, like we are rightly so focused on the individuals and making sure that people can pay their rent and making sure they get their unemployment benefits. But if 4 weeks from now, restaurants, cab companies, gig economies, small businesses are permanently closed and their owners are in bankruptcy, those jobs won't come back anytime soon, right? And we will be in a sort of, you know, semi-permanent space of poverty. And one big thing that I have noticed in dealing with this crisis, there's no real mechanism by which to allow philanthropy or individuals to make anything other than cash transactions with small businesses in America. And that is, we weren't looking for, we didn't see that hole because we didn't need to exercise it, because if a hurricane rolls through or Sandy rolled through, there was FEMA money because the buildings were destroyed, right? That helped rebuild. And so like, it's like the fact that these buildings weren't destroyed, but the businesses still were, is fascinating to me. So that's, you know, I feel like that's going to be my next career, is trying to figure out, you know, what the next stabilization fund for small businesses in the country, especially in food, is, and how we tap more corporate and philanthropic dollars to make sure that that fund is always there and doesn't have to be built from the ground up every time something happens.
Yeah, I think you hit on a really interesting point. It's, you know, again, like that last mile, how do you get the money to these businesses that are in need if, you know, the philanthropist exists? NYP has done something fairly interesting in the past, like 2 weeks, where our CEO said that like he's putting $10 million into Northern Manhattan, and they've created like such a simple application for people, for any business to apply to. So this is a plug. If you know of any small business, small organization, daycare, whatever in North Manhattan that is, you know, in needs of funds, they should go to the Hispanic Federation website, and we can include this in the follow-up email, and apply. It's a really simple application, and it gets money back into the community and back to these businesses. But you're right, like if an anchor institution like NYP didn't step in, like how would that happen? So I think that, yeah, it might not happen, right?
Yeah.
I think it is interesting, like, right, I think to that point of a speedy philanthropy, like we're seeing a lot of grants that are incredibly fast. And it's philanthropy is turning quickly to say, we're not gonna make you go through our same huge hoops of measurement and all these things. Like, we know you're a trusted partner and you can get food or whatever service you do out the door. So here's the money. We're not going to make you take more than 45 minutes to fill out an application that normally takes us 2 weeks. I think that's an important thing to remember. Like, sometimes we need to like not have to worry so much about the process and be able to get to the outcome. I think it's the same, and I'll put this as a big picture, more business picture hat. Like, right, we're in discussions and talks about mergers and acquisitions and collaborations because we need to be thinking more efficiently. And it's not about just having big players out there, but mergers don't have to be horizontal. They can be vertical, right? Like, how do we support each other so we actually, when this comes back again, and right, like from an epidemiological standpoint, like no one knows what's going to happen in November right now, right? Like, we need to be ready, and we need to be ready in different ways. And we can't be building from the ground up, as Katherine said, every time.
We probably have time for about 1 or 2 more questions, but I do want to let everyone who's on the webinar know that we will compile all these resources that everyone's spoken about today and try to answer all the questions in the Q&A when we follow up. So I'll let Greg, hand it back over to Greg for.
I think Katherine is about to speak.
Oh, sorry.
No.
I wasn't.
Oh, no.
I can't, I mean, I certainly.
No, there's a couple questions. There's a question about other examples, I guess, of New York City-based kitchens that are producing and delivering it said medically tailored meals. I know at WISCA, we receive for our staff and volunteers every day right now, twice a week I get Dig In donated 30 or 35 meals. Maison Pickle on the Upper West Side and Jacob's Pickles doing that 3 days a week. Field Trip's gonna start doing that for us. We're not getting medically tailored meals. I mean, we are getting a large number of vegetarian, but I haven't heard yet of any medically tailored.
Yeah, I haven't heard about medically tailored meals either. You know, I feel like a lot of the folks that are doing sort of the larger, you know, 2,500, 25,000 meals are really picking dishes that are like neutral, right? In flavors or deliveries, or like trying to think about things that could be consumed by the broadest number of people and not have to worry about, not have to tailor to specific allergies or, you know, pieces. So it's complicated, but I do know that some of the restaurants and I would encourage everybody, it sounds like I'll plug, I have been super impressed with the coverage of eater.com. So the New York Eater page has COVID resources. They are, you know, updating regularly. They are doing tons of stories about things that are specific to New York City. The other is the Restaurant Workers Community Foundation, which is a relatively new organization, just about 2 years old. But I don't know how they did it. I don't know what bot they've got set up, but they literally have the best compilation of resources related to grants, funds, restaurants doing things, newspaper articles. I visit it every day, multiple times a day as a compilation resource. But I think, you know, for really specific pieces of coverage, one would just encourage everybody to go to the New York Eater site, because I just feel like they've been doing the best work. But the Restaurant Community Foundation, Restaurant Workers Community Foundation, just has the best compilation of resources.
Great. There's a couple of questions about farmers and supply chain as well. I mean, we're seeing a lot of farmers, actually a few from the Hudson Valley, who have called us up directly and are calling different pantries and saying, can we drop off, you know, we got literally a truckload of eggs, amazing farm fresh eggs last week. We're seeing apples in the same way. I think, you know, reaching out to your local food bank, you know, if it's Feeding Westchester or Food Bank of New York City or City Harvest, they have mechanisms to do pickups and find distribution points to get food to people in need, right? We don't know what's going to happen for farmers. You know, I think there's just questions for them for how there's their fear of like, who's going to be buying their food, especially the high-end farmers, you know, who sell to high-end restaurants and to farmers markets. Like, this is a big fear. So I don't know if there's no answer there. I think this is a gamble. I mean, farmers gamble every year on weather and, you know, all kinds of things. And now they have to gamble on virus.
Yeah, I mean, and this is again just another plug for the Eater did do a pretty comprehensive look at the farmers that at least a week ago were providing CSAs where they hadn't before. It is, but bigger organizations like Misfit or Imperfect Foods and folks that focus on food waste and repurposing, they have CSAs that are more national. Dr. Dish has a CSA for seafood. They're still supplying and taking fish off docks from small fishermen. A lot of these are in local supply, and really, unfortunately, a lot of them are only available to people who have the means to have them. And I've just been even struck. I mean, I said at the beginning, we live in Queens, and the zip code discrepancy between who will deliver to Manhattan and who will deliver to Queens is really jarring. And so it does go to that last mile. How do we get food to people? But even as a small family that has the resources to order from those things, based off the geography in our zip code, we don't have access to them, right? And so this is a moment where I think where it's testing a lot of those sort of delivery systems and those pieces. But there are farmers, they are out there doing it. Folks in New Jersey, Pennsylvania, New York, folks are still coming in to do green market at Union Square. And so if you're, and there's practicing social distancing and physical distancing there's still farmers markets up and running. So even if you can't get a CSA delivered to your house, there may be some options related to pickup. And that's the other place that restaurants have been serving as drop-off points in their local communities for CSAs who will deliver sort of in bulk. There's not a good resource. It's really a patchwork solution. There's not a great place to send this audience to find all of them listed. You're gonna have to practice all your Google powers, but they are out there.
In that vein, we've been, I know we're pressed for time, but just to jump in last, we've been connecting our food insecure patients with a CSA through Corbin Hill, because I think it's really important to be able to support the farmers and provide food insecure patients with food that's local, organic, all that good stuff. So I think, there's capacity for organizations like NYP to support in that way.
Great. Well, it looks like, we've come up to time. I'll give my final plug to, if you go onto WSCA's website, www.wscah.org, you can check us out and follow along and support us. You can go to jamesbeardfoundation.org and check them out. And go to the James Beard House once things are back up and rolling, and go and have an amazing meal, and stop by any of our NYP sites as we keep growing them. So I thank everyone for joining us today, and I'll turn it over to Gwen if she has any final wrap up.
Yep. Thank you very much to all of our panelists. This has been super interesting. As I mentioned, we'll send out many of the resources that you mentioned today to everyone who's joined us. It's just really impressive to hear how flexible and nimble that you all can be during this time. And we appreciate all the work you're doing here in our city. And hopefully we'll have you back in a month or two to hear how things are improving. Thank you all.
All right. Thank you.
Thank you very much.